nationally, we need to make sure that there is constant vigilance, that people are looking at these new strains.
Michigan health leaders are keeping a close watch tonight for a new, more resistant variant of the COVID virus. This new mutated COVID-19 virus has been dubbed the Cicada variant. News 10's Riley Connell here in studio now with what you need to know. And first, Riley, we needed to know why it's being called the Cicada variant.
Yeah, David. Well, much like that cicada bug, this COVID variant has been lying dormant for about a year since it emerged, but top health officials say it is spreading more rapidly now. Doctors here in Michigan say there's no reason to panic, just take precautions.
It's been waiting in the wings for more than a year, and now the Cicada variant of COVID-19 is making its appearance.
An important thing to bear in mind about the Cicada variant is what the data that we're seeing that prompted the health alert was that we were seeing more of it kind of in the water supply.
Michigan State University infectious disease expert Dr. Rebecca Shine says this mutation of the COVID virus has mainly been identified through wastewater testing. However, the Centers for Disease Control and Prevention says it has been detected in at least 29 patients across 29 states.
But we don't actually know what impact that is causing on people, because when we test people, we test them just for COVID and not necessarily for the specific variant.
The Cicada variant is somewhat resistant to herd immunity and vaccination. The CDC's most recent morbidity and mortality report highlights that point, saying although infection and vaccination have lowered rates of severe COVID-19, the virus's public health impact is still considerable. Michigan's chief medical executive, Dr. Natasha Bagdasarian, says there is no cause for concern.
We really have advanced in technology. We've got not only testing that's available, but testing that you can do in your own home. We've got antivirals that are available. And of course, we've got these amazing vaccines, and those vaccines are updated every year so that we make sure we're getting the right vaccine.
Doctors Bagdasarian and Shine tell me frequent hand washing, wiping down surfaces, and of course staying home when you feel sick are the recommended best practices no matter what strain of COVID is going around. They add the COVID-19 vaccine is widely available, safe, and effective. Back to you, David.
All right, Riley, thank you. You can stay up to date on the spread of infectious disease in your area by visiting the State Health Department's website. The department provides weekly disease reports.